Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. We are very proud to introduce our first 7 LDN specialists that have completed and passed the LDN Masterclass. Today we're joined by Pharmacist Stephen Dixon from Scotland, from Dixon's Chemist. Thank you for joining us today, Stephen.
Hi, it's nice to see you, Linda.
I'd like to congratulate you. You're the first person that has passed our LDN Masterclass, so now you are officially an LDN specialist. Just in case you were in any doubt before.
I suppose it's one of those things which it's nice to have the title, but I think we've been doing this for long enough that we literally wrote the book about it, didn't we?
Exactly. What do you think people will gain by taking this test?
Since we started doing LDN, so much has changed and we've learned so much about different conditions, about different ways of using it for autoimmunity. I mean, there were things in the course I genuinely did learn that I didn't know. I think that's really quite interesting. It reflects a consolidation of the advice and the way that we work together with professions across in the US and in the UK and in the EU. So I think the way that the course is designed, it will generate a team of prescribers across the world who are all singing from the same hymn sheet, using the same advice and gathering evidence in the same way. So I think that's the main benefit of it, it's standardization.
Okay, Stephen, well, thank you very much for sharing your thoughts with us on that. We are joined today by Pharmacist, Dr. Sam Ledcock, who is the Director of Clinical Trials for Belmar Pharm Solutions, and they're based in Colorado in the US, and they ship to 46 states. Thanks for joining us today, Sam.
Thanks for having me, Linda.
And congratulations on passing the LDN Research Trust Masterclass. So you're now a verified LDN specialist.
Thank you. I'm excited about it.
Well, it wasn't an easy test, as we have discussed, and thank you for taking the time to do that. Can you tell us why it is so important for doctors and pharmacists to share the same information and education?
I think it's really important to benefit the patients if everyone is giving uniform information. Pharmacists can really be at the leading role for doctors and help them if they're really well educated. They can kind of hold their hands, answer a lot of patient questions, make sure they're dosing it appropriately. There's dosing protocols. We can also talk about any drug interactions. So we can really help the providers, free them up a little bit if everyone is well educated, and really help give the best patient care. Belmar has expanded very recently. We recently purchased, acquired, I guess you could say, a couple other pharmacies, Women International Pharmacy and also APS Pharmacy. So at almost all of our locations, we're almost able to ship to every state. So we are really expanding, and we want to be the leaders, and any type of patient care or consultation you need, we're happy to help.
We are joined today by Pharmacist, Dr. Sam Ledcock, who is the Director of Clinical Trials for Belmar Pharm Solutions, and they're based in Colorado in the US, and they ship to 46 states. Thanks for joining us today, Sam.
Thanks for having me, Linda.
And congratulations on passing the LDN Research Trust Masterclass. So you're now a verified LDN specialist.
Thank you. I'm excited about it.
Well, it wasn't an easy test, as we have discussed, and thank you for taking the time to do that. Can you tell us why it is so important for doctors and pharmacists to share the same information and education?
I think it's really important to benefit the patients if everyone is giving uniform information. Pharmacists can really be at the leading role for doctors and help them if they're really well educated. They can kind of hold their hands, answer a lot of patient questions, make sure they're dosing it appropriately. There's dosing protocols. We can also talk about any drug interaction. So we can really be really help the providers, free them up a little bit if everyone is well educated, and really help give the best patient care. Belmar has expanded very recently. We recently purchased, acquired, I guess you could say, a couple other pharmacies, Women International Pharmacy and also APS Pharmacy. So at almost all of our locations, we're almost able to ship to every state. So we are really expanding, and we want to be the leaders, and any type of patient care or consultation you need, we're happy to help.
I'd like to introduce pharmacist Mikhail Moser from Makers Compounding Pharmacy in Northwest Washington State. Thank you for joining us, Michelle.
Thanks for having me. This is wonderful.
And congratulations on passing the test. I know it wasn't the easiest thing to do. Could you tell us why you think having this masterclass and the exam is of benefit to the medical professionals?
Well, I was so excited that so much effort and thought had gone into putting together a class to begin with. There's a lot of information out there. I think it needs to come from credible sources. There is so many questions as to why we're not hearing about low-dose naltrexone from big pharma, or why so many physicians are not necessarily fully versed on the benefits of low-dose naltrexone. So to have such an esteemed group of professionals get together to not only record sessions in which those topics that they're expert in, but then to develop questions from that. The questions were very good. The test was very comprehensive. It covered many, many disease states, but also the idiosyncrasies of low-dose naltrexone. And I think that that's really important. I really enjoyed that you had to pass with a very, very high mark. That is very important. An average individual is not necessarily who we would call a master, right? So it does take some time. I personally had some technical difficulties. I didn't realize I had a pop-up blocker on my screen. So, but I'm thrilled to be one of the first few that was able to complete this class.
Well, thank you very much, and we look forward to hearing more from you in the future.
Thanks so much, Linda. Have a wonderful day.
Today we're joined by pharmacist Dr. Masoud Rashidi, who is our 4th LDN specialist. Thank you for joining us today, Masoud.
Thank you for having me, Linda.
Can you tell us what made you decide to take the exam to become an LDN specialist?
One of the reasons, we do a lot of LDN already in the pharmacy and do a lot of lectures for the doctors, patients, but I wanted to get more insight of what else is going on all over nation or world, because some of these speakers are from different part of the world. And I gained a lot of knowledge from that, not only on LDN, but a lot of disease state that kind of LDN can contribute, which some of them I didn't know, I've never heard, and it was a great first time learning. And I really learned a lot, and I encourage people that they're trying to do this. The more of us around, the better, just because then you get more of unity across the nation or world, just so we're working on the same things, and then we can share more ideas between each other. That's one of the really reason I took the exam, and I went through it just because I thought I knew a lot, but then I was missing a lot. So I'm glad I did, because now I learned a lot more, which was really good and eye-opening for me. It's so much more you can do with the LDN.
Mm-hmm. And you're so right with saying that, you can learn from other people. It's all about trying to uniform that information.
We have this huge, I'm not going to name them, but there's a huge practice around in California that they only use 5 milligram. And we have been telling them, you starting 5, where did you even get 5 milligram? I know everybody talks about 4.5. How did you come up with 5 milligram? I have no idea how they come up, and they just did it, and they're still doing. And then when we get their patients and we start them on the lower dose or the dose that works for them, they were like, wow, what a difference. I almost gave up on this. It didn't work. It was making me like jittery. And I'm like, yeah, because you have to start it right. And we've told some of these doctors now, they just call us and say, because they can only get 5 milligrams for whatever reason. But then you're absolutely right. The education should be there, and they need to know, so they don't think it's just whatever dose you start is a good starting dose.
Congratulations and thank you for being part of the team.
Yeah, thank you. Appreciate it for the opportunity. It was really good and valuable to me. Thank you.
We're joined today by Angie Fieldson, who is our 5th LDN specialist. Thank you for joining us, Angie.
Thank you for having me, Linda.
So tell me, you are not a pharmacist, you are not a prescriber. Tell me why you wanted to take this masterclass.
Well, as the Director of Marketing of Solutions Pharmacy, and I've been here for 22 years, I have the very great privilege of speaking to physicians all over the nation. We're currently licensed in about 22 states, so there's a lot of physicians that I call on a daily basis. What my job is to educate them on the compounded medications that we make. We were currently making the LDN and seeing great results with it prior to me going to the 2 conferences that I went to this year. The second one being yours in June. After I went to your LDN course, the passion just flew all over me for LDN. Seeing how many disease states could be helped by LDN, learning the terminology, learning how the mechanism of action was going to work in the body, and I can relay this to our physicians to help them better understand it. My goal with the master course was for me to learn as much information as I could about LDN. What I found during the course is the unity was unbelievable with the professional speakers. Everyone was very unified on their thinking, on dosing, problem solving. However, they would give the flexibility as well for the providers to look at that individual patient to see if they needed to go lower or slower, or perhaps back up, or perhaps stop at 3 milligrams or wherever they might need to stop. So when I was taking the course, I just got more excited every single lecture that I would listen to at the possibilities of reaching millions of patients and helping the patients receive a better quality of life. That's what drives me. So if that answers your question, I hope it does.
Yes, it does. And really, congratulations. You did amazing, and it was such a privilege for you to ask, I'm not a medical professional, please can I take this exam? We were very pleased to have you take part and join the team.
Well, thank you. I am so happy to have done the course, passed it, and now I can spread the knowledge to the providers that I know so they can do their job well.
Today we're joined by Pharmacist Terry Wingo, who is our 6th LDN specialist. Thank you for joining us today, Terry.
Thanks for having me, Linda. I appreciate it.
Could you tell us your experience of taking the masterclass exam?
I'll be glad to. This was something I've been looking forward to and had trouble finding time to do it. So I finally set aside 3 weekends and binged it and just made myself go through. But I thought it was important. I thought it was important from the start when I saw it first identified as coming up as available for us. I think it's a big deal that we know as much as we can about this. There's so many people that are impacted by low-dose naltrexone or have the potential to be benefited by low-dose naltrexone. And so many of our practitioners are not experienced in that. And so we're trying to do our best over the last few years to have classes for practitioners to try to bring some up to speed. And now we're seeing more and more patients being treated because of that. And that's excellent. But I wanted to be sure that I was aware of all the underlying pieces. And that was so interesting in the roughly 40 hours of presentations to learn not just more about the use of LDN in certain conditions, but about the underlying issues within those conditions themselves. So I think it will be very, very useful. I'll be encouraging everyone that I'm aware of as prescribers to look at this process as well.
again, thank you very much for having taken the course, and thank you so much for passing. I know it is a lot of time that you have to dedicate to actually do that. And of course, the pass mark being 95% is really high. So there's not much wriggle room there to get things wrong.
Well, it's a good accountability, and I'm glad that the accountability part was there. I think that really made it more valuable to realize that we had to take it as seriously as we could.
Mm-hmm. Well, thank you very much for having joined us.
Thank you.
Today we're joined by Michael McCorkley, who is our 7th LDN specialist. Thank you very much for joining us today, Michael.
Nice to be here.
So, can you tell us, what was your experience of taking the LDN masterclass?
Yeah, so I think the LDN masterclass had so much good kind of information in it with regards to a number of different conditions that LDN is used for and that people are using it for kind of just now. So I think really the kind of experience I had, it was all round, it was fantastic. It really kind of tied everything up together for me. And also answered quite a few questions that I had myself about a number of the conditions and what LDN, can do and how it's useful for those. So I think it was really good at kind of bringing it all together in one place, to be honest, and kind of ticking a lot of boxes off, a lot of questions that not only patients but also a lot of prescribers might have about LDN.
Why do you think education on LDN is so important?
I think because a lot of people see it as a very kind of grey area at the moment. There is a lot of information out there with regards to LDN. A lot of different forums with, even on Facebook for the likes of that a lot of patients go to. So I think that, to bring, all the information together in one place and to put information out there that is more concise and relevant for patients, as opposed to, a lot of the information that is out there just now. So I think in order to, bring all the information together in one place really is the main thing, and to have all the prescribers who are, having consults with patients with regards to LDN, to kind of be, everyone using the same information and advising the same, obviously providing the same or kind of uniform advice across the board with regards to LDN and, a lot of the conditions it's used for.
Mm-hmm. And how did you find taking the test? Did you find it easy?
No, no, it wasn't. But what I would say is that the videos that are available for, from the conferences and things like that, they're a great help. They're fantastic. A lot of really good information in those videos. Obviously, it breaks it down to conditions specifically. So yeah, the videos are really, really good. A good component for with the whole kind of obviously before sitting the test.
Well, again, congratulations and thank you very much.
No, thank you so much.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.